What's up, everybody? Welcome back to the Pain Sucks podcast. I'm Dr. Matt.
Dr. Justin, guys.
Hey, and so the last couple podcasts you've been listening, we've been talking about shoulder, we've been talking about knees, pain. We've talked about the different levels of pain and the different ways that you can go about handling it. However, today what we want to do is teach you and sort of educate you on something that's been making massive change. And so I want to introduce you to what we call our double wave, our shockwave, sometimes called pulse wave. And Dr. Justin, how does this thing work?
This thing combines some really cool technologies, okay? So everybody's talking about the different technologies. They can go in, they can get ultrasound done, or they've had stim done before. What this does is it kind of combines all of that into one modality, like that, where you're getting true, like, pulsed ultrasound acoustic style waves that drive deep into
down the line here.
Like that deep into a joint. So ultrasound in and of itself isn't painful, so you don't feel those waves driving in. But think of ultrasound as a deep heat. Like that, it goes into a joint, it's going to break up that deep tissue, just not on the surface, but deep, and it's going to bring extra blood flow into that joint. So it's great for inflamed joints, it's great for chronic injuries. Ultrasound works very well on certain muscle tissues. The neat thing with this one is that this one produces an electrical stim with it. Okay, the electrical stim is a vitally important part because that drives in anytime you've got that injury. You've got some like most of them have some kind of like dead old scar tissue in there. You're getting some scar tissue formation in that joint. And what that electrical stim does is after that pulse wave breaks it up, is it hits the mitochondria in those cells and it reactivates them. So you not only get some blood flow to that area, but you get a healing reaction.
So I have we've been really impressed with the machine. We love it. It's busy all the time. We're always seem to be running advertisements with it because it really works. We were talking about the shoulder and the knee, and people are coming in, and we're just literally placing this right on there and just kind of moving it through the sore. And then what's happening is those ultrasounds are going in, followed by that electric stim, and we're literally not only tearing up the old stuff, but we're activating energetic processes and blood flow to bring in new and flush it all out. And people are having ridiculous results off the bat.
The key is that this is considered regenerative. Okay, it's not just a pain management. It's not just a Band-Aid. Like, because of the way it activates, yes, it's going to help all of those things instantly, but it's going to help regenerate, regrow, repair the damage that was there in the first place.
Exactly. And I would say, like, if someone's sitting there listening right now and they're like, "Oh, I want to try that." I mean, of course, come and try it. But then they ask, like, "Well, how long will it take? How long do we have to do this?" And we've pretty much noticed that somewhere between 4 and 6 weeks, a couple times a week, is really that kind of time where your body is learning to use this technology, healing things up, and then getting to a place where it can kind of stay that way.
Yeah, definitely. Almost never is there a one-time fix. People come in and they feel great afterwards and they're like, it's done. It's like, that's going to take a little while. I mean, look, ligaments take 6, 8, 12 weeks to heal if you injure one of them. It's not just an overnight process. Now, you can speed up that process. Okay. So a lot of things, we talk about knees and shoulders a lot, but one of the things that this excels at, that we do all the time, it's plantar fasciitis. It's foot problems. Okay. People don't think about it for foot problems like that. But your foot's got a gigantic ligament on the bottom of it. Like that activates or it re-injures it. Okay. They go to a podiatrist and they get sold a $1,000 pair of orthotics. Okay. Or told to stretch at home. And it's like, it probably doesn't work. No, you break up the tissue, you start retraining the tissue, you get healing reactions in the tissue. You got like a 95% fix rate with plantar fasciitis. It's one of these things we fix.
Exactly. What's really great about this, it's literally like anywhere from 2.5 to 3 minutes. So it's not like it's this long, drawn-out session. It's incredibly not painful, which is what people go, "Oh, that looks painful." Incredibly not painful.
It's loud. It doesn't hurt. Now you're going to feel the electrical stim.
You have to.
I make no joke about it when people come in. They're like, "Does it hurt?" I go, "No, it doesn't hurt." But it's weird. It's a different sensation for sure. And we run it on people and they jump for a little bit and they're like, "Yeah, that doesn't hurt, but that is weird."
Well, a lot of people have probably used a TENS machine or maybe gone to the physical therapist or wherever and done like some electric stim. So it's along that line, but mixed with that ultrasound, it becomes something on steroids that literally just fixes issues. So you mentioned plantar fasciitis. We've clearly been doing a ton with the knee and the shoulder. What other quick things have you noticed that's worked really well for us?
Let's see, we've done a lot of biceps tendons
Yeah.
like that, where that bicep elbow
Elbows,
area like that. So
tennis
you have,
elbow, golfer's
yes, I was
elbow.
going to say in that
Yeah.
same region here. So on
Right.
the outside of your elbow,
Right.
tennis elbow, golfer's elbow. On the
Right.
inside of your elbow is where that biceps inserts.
Yeah.
Okay. So anybody that sits at a desk all day long, carpal tunnel-ish
Right.
problems like that,
Right.
we can release all of that.
And
That's a big
really,
one.
the truth of the matter, it can be used anywhere.
Yes.
So anywhere there's ligament tendon issues. So the spine, we've used it on. We've
traps
used,
with everybody gets those trigger points and the
Yeah.
traps. Those people come in, they're just like constantly
Right.
need a massage every single day.
Right.
And there's some other issues that cause that, but once
Right.
you fix that,
Right.
we can really work on that area and get those muscles to calm down.
So one of the things I want to tell you guys as we're finishing this up, and if you're obviously looking at this, you can just look at the show notes below and contact us, and feel free to come on in and give this thing a shot. One of the things I want to tell you though is that this alone is really powerful, but this paired with chiropractic care, this paired with home rehab
Yes.
and stretching and exercise and lifestyle is very powerful. And this combined with regenerative stuff,
Yes.
like we've been talking in previous videos, whether you're talking about PRP or going up to a next level of stem cells or even add exosomes to your life, we've literally taken x-rays of folks down the road and seen complete joints repaired as we put all these things together.
Almost never, Matt, since we've been doing this, almost never do we do stem cells on somebody.
Right.
On injections on a joint.
Right.
That doesn't do this with it. That we
Right.
don't use this on the joint. We go, look, as part of the regen healing process, we're going to give it everything it needs to heal. And we're going to wait a little while for it to set. And then we're going to start rehealing it.
Right.
And we're going to rehab this
Right.
thing like that. So these things work in combination, and it's a building block process.
Right.
Some only need this.
Yeah.
Some need a little bit more, and some
Right.
need a lot more.
Right. And one thing I will say is that as they do build, some people think like, well, if I add this to that and this to that, it'll get better quicker.
Yeah.
This actually becomes exponential.
Yes.
So instead of that like I'm getting better, this thing makes it go like
Yes.
this. And that's what we really want for people when they combine everything
Yes.
together. Well, it's really one of the reasons we've added all these wonderful things here is because we really want you to have that exponential
Exactly right.
way of life.
Unfortunately, a lot of people come in and they want to piece stuff together. You've
Right.
seen this. We've
Yeah.
had these talks all the time where they're like, well, I want to do this for a month and see how it does. And then
Right.
after a month, I'll stop this and I'll do this
Right.
over here. And I'll take, I'll do a PRP shot. And then I'll wait a month and then I'll do this one.
Yeah.
It's like, nah. It's like you might get, if you piece them together like that, you might get 50% better. I don't know. We don't know which one may help or whatever.
Right.
But when they do them all together
Right.
at the same time and you hit that round, it's done. Like it's the greatest healing thing you can do.
So I know that we tend to on some of these podcasts have that moment just like now where we sort of rant and rave about like why we do things together. It's because it's that super important to us. We get calls all the time from folks that try to piecemeal things together. But bringing it back to this machine, again, let's just summarize this sucker. So we've got ultrasound waves that are passing through this wand. We've got electric stim passing through this wand. We've got a special technology that's able to drive it deep.
Yep.
And what it's doing is really just cleaning up all those bad areas and then bringing great healing behind it. And it's a wonderful, wonderful thing for a few minutes, a couple of times a week to change your life.
It's been in practice 13 years.
Yeah.
It's been one of the best things we've added to the clinic.
Yeah.
Hands down. Like that better. There's nothing else besides the regen med, besides
Right.
some injections
Right.
maybe and stuff like that, to get that kind of results that fast, immediately.
Yeah.
Okay. It's been the greatest thing.
So you're not only the doc, you're also a customer.
Yeah, absolutely.
Same.
I use this weekly, use it
Yeah.
on my own knees. You know, the college football
Yeah.
injury, you talked about the knee
Right.
surgery.
Right.
I go to the gym 5 or 6 days a week. I'm using the pulse wave on my knee
Yeah.
to keep that thing healthy,
Yeah.
to keep the scar tissue out of it, to keep it strong.
And what's really great is you can go really pretty much anywhere and kind of Google this machine and learn more about it. But we would encourage you to go ahead and take a listen, share, subscribe, and like.
Yeah.
And then at the bottom, just give us a ring. Like reach out through some of the contacts we have. Come on in here. Give this one a try. See if this can set you free from some of the things that are going on. So that's this week's Pain Sucks podcast. I want you guys to have a great day. Remember our tagline. Nobody, and we mean nobody, gets to tell you that you can't heal. Be blessed.